So I wanted to chat about IBS and SIBO. I know that they can affect the pelvic floor significantly, and there may be a lot of women out there dealing with that. I work primarily with pelvic floor conditions um,
Mm.
and women who have pelvic floor dysfunction. And so oftentimes a lot of women have issues with constipation. They have issues with chronic, bowel issues, diarrhea, things of that sort. And so, a lot of women are looking for help and more natural remedies and methods. What can I do on my own without having to go to the doctor, without having to have surgeries, invasive techniques, medication, all that type of thing, especially because, most women are like, well, what if it doesn't work? I've done all
Yeah,
this stuff. I've gone to the doctor. I've taken all these drugs. What if it doesn't work? What impact will that have on my body? So,
great. Sounds good.
mhm. All right. So, um, more specifically, can you go into what specifically, I should say, is IBS and what is the difference between that and SIBO?
Sure. I'll probably just introduce myself first. So, my
Yep,
name's
we should do that.
my name is Kirsten Swales, and I work online as a naturopath, a nutritionist, and a herbalist.
Hmm.
And I specialize in digestive health. So this is my area of expertise. I absolutely love it. I get very excited about it.
Hmm.
And the universe really helped me out with my calling because I had a lifetime of digestive issues without really knowing what was wrong. And so by healing myself, I learned about all these different things. And now, so pretty much any of my client that has any sort of symptom, I know what it feels like because I've gone through it myself.
Hmm. Hmm.
So to answer your question, the difference between IBS and SIBO. So IBS is the acronym for irritable bowel syndrome,
Hmm.
and then the SIBO is the acronym for small intestinal bacterial overgrowth. And most cases of IBS, actually, studies have shown up to 84% of IBS cases are caused by SIBO. So IBS would be, so anytime you hear the word syndrome, it
Hmm.
refers to a collection of symptoms. So the symptoms of IBS, the most common one would be bloating. It can be diarrhea, it can be constipation, it can be an alternation between the two.
Right.
You'll often see food intolerances. And then with SIBO, the classic sort of symptom of SIBO would be that pregnant 6 months, looking 6 months pregnant, kind of bloating, typically within 1 to 3 hours after eating, because then it's in the small intestine. And it's important to know that it's not just an overgrowth of bad bacteria. It can be the good bacteria, like our lactobacilli. It's just got into the wrong spot.
Wrong,
The
yeah.
small intestine should be relatively sterile, and all the bacteria should be in our large intestine.
Hmm.
That's the difference between the two. And a lot of people just get told that they just have IBS and to just go on the FODMAP diet, but it
Hmm.
doesn't tell you why you've got the IBS. So
Mm.
SIBO can be the cause of the IBS, which is fixable, and then you can get back to being nice and healthy.
Hmm.
Yeah.
Now, what about you did mention they can have diarrhea or they can have constipation. I think for a lot of people, they don't realize that with IBS, they can also have constipation. So, are there other specific symptoms that people should be aware of?
Well, those would be the gut ones, and then food intolerances for sure.
Hmm.
Because if the digestive system has been irritated and inflamed for a while, then
Hmm.
anything that you try and eat is going to be aggravating too. I was using an example, like say with my arm at the moment, it's nice and healthy, the skin is intact, so I can touch anything I like and it won't hurt. Whereas if I burn it on the stove, that open wound is going to be very sensitive. So anything I try to touch will be aggravating. Same in the digestive system if it's not very healthy.
Hmm.
So those would be the gut ones that you notice, and the gas as well. So they can definitely be gas. But if it goes on for too long, then the inflammation can spread into the rest of the body, and
Hmm.
then you can notice things like joint pain, fatigue, headaches, depression, anxiety, issues with your menstrual cycle.
Right.
Inflammation would be at the root cause of many, 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 many diabetes, blood sugar regulations, weight
Hmm.
issues. Pretty much, pretty much, if you tell me anything, I can tie it back to the gut because it all starts in the gut.
It all starts in the gut. And that's the thing, a lot of people don't realize the connection between their gut health. And like I always tell people, you are what you eat. So, people don't realize that the habits that they have can affect, their gut, it can affect their system. And then it plays a role in so many other areas of their life because then it extends beyond that.
Yeah.
So for a lot of women that are having these issues, we typically will find, or I should say, I will find that, let's say they're having the diarrhea, let's say they're having the constipation, and I'll start with the diarrhea first. If they're having diarrhea and they're irritated, oftentimes, they may be having issues with just that frequency, and maybe even some infection as a result of that, because they're having constantly having to wipe, or things like that, and oftentimes that may lead to not only irritation within that pelvic, that perineal region, but also possibly other infections as well. So it's saying that a lot of women, they're having issues with constipation. They're bearing down all the time. They're having a hard time trying to go to the bathroom. And this is leading to issues with prolapse symptoms. So now, whereas, they're thinking, oh, when I have they're thinking of these as two separate things, not maybe one causing the other, or one being associated with the other. And oftentimes, we'll have women coming in and they're saying, well, I'm having these pelvic floor symptoms. And, in more detailed assessment, I ask, well, what is your diet like? What are you eating? They're like, what does that have to do with my pelvic floor? And it's like, well, it has a lot, because if you're having issues with, what are your toileting habits looking like? And they're like, but what does that have to do with my pelvic floor? And then you find out that they may be constipated, and you're finding all these other things. You start peeling away the layers, and you realize by the time you get to the root of it, well, this may be part of a gut issue. Let's start to make some changes. So, that being said, what recommendations do you have holistically for a lot of people who are suffering from, let's say, IBS, either, the diarrhea, the constipation? Are the strategies the same? Are they different? And if so, what recommendations would you have?
I'd say the method tends to be very similar, but then the specifics of the actual treatment would 100% vary from person to person, because it's not just about the digestive system, it's about the whole body and what's going on in their outside life. What are they eating? What are they not eating? How are they responding to stress? How is their sleep? Are they moving? All these different things impact on our gut health and overall health.
Mm-hmm.
And it's very important to find out the root cause, because you can definitely manage symptoms, but you don't want to get in that trap of, say, on the pharmaceutical side, if you've got a headache, you can take a Panadol or a paracetamol.
Mm-hmm.
You can do the same thing with natural medicine, but that's not very holistic. So the FODMAP diet gets prescribed quite a lot for IBS symptoms, which is an acronym, a bunch of big words standing for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, which pretty much means the fermentable sugars in the plant foods. So this helps to reduce a whole bunch of symptoms, because these fibers are the preferred food for the bacteria in the digestive system. So it helps to reduce the symptoms of bloating, because there's no food for the bacteria to eat. But if you do that for too long, then you also starve your good bacteria. So then you paint yourself into a corner with your microbiome, and you'll find that the foods will get restricted, and you'll probably be left up eating chicken and eggs, just like I was. This was me. Yeah, so you need to, the number one cause of constipation is actually dehydration. So a lot of people think it's the fiber, but water is first, because we need there's so many functions in the body that require the water. And if we're not drinking it, then it's going to take it where it can get it from, which is your stool. So then you have this very dried up poo sitting in your colon that can't move through. And then with diarrhea, it's often that something is, I want to clarify the difference between diarrhea and loose stools, actually. So diarrhea is if it kind of just squirts out very fast, often liquidy, maybe yellow or greeny, sometimes bubbly. Whereas a loose stool would be, it just kind of comes out and falls apart a little bit. So the urgency is the differentiating factor there. So if you've got loose stools, then you could just try adding in some more fiber, and that is called a bulking agent. So it helps to draw water into the stool, it helps to bulk it up a little bit so it can pass again through these muscles of the colon. If it's diarrhea, then you need to find out why you're having diarrhea, because the body is trying to expel something that's irritating the intestines. It could be bacteria, it could be parasites, it could just be a chronically inflamed gut. Because back to my example of the hand with the burning on the stove, if something's aggravating it, you want to move it along as quickly as possible. So water, definitely. And then you also want to look into what movement that you're doing, because the bowel wall is a muscle as well, and it relies on something called peristalsis, which is the movement and the contractions of the muscles to push everything through. And then with pelvic pain, if someone is chronically constipated, it doesn't have the muscles to push things through.
Yeah.
And then also it's going to start to expand. And there's all these nerve endings in the digestive system. It's called the enteric nervous system. And we have more nerve endings in the enteric nervous system than we do the spinal cord. And so they kind of work by pressure. So if your bowel wall is expanding with all this feces in there, it's going to press on these nerve endings. And if it's stimulated too much, just like us, if someone is honking their horn behind us in traffic, after about the 10th honk, we're going to get really irritated.
Yeah.
So if you're aggravating these nerves all the time, then they become hypersensitive. So then they're going to react to things that they wouldn't have reacted before because they're just overstimulated all the time. This is something called visceral hypersensitivity. Mm-hmm. So then if there's also not an incomplete passing through of all the waste, we can end up with the inflammation in the digestive system. If that goes on too long, then you can develop leaky gut. Then things that are meant to stay in the digestive system and get passed through start to leak into the rest of the body, into the bloodstream. Then that can cause inflammation of the ovaries, and that can cause inflammation of the uterus, that can cause inflammation of the brain. And then we can feel all these different symptoms.
And now what about before I ask that question, what about recommendations you would make for, let's say, a pregnant mom? Now she's got other considerations. Would the recommendations change? Would they stay the same?
No, they would definitely change. So when I'm treating SIBO, there's lots of antimicrobials and lots of antibacterials because we need to kill the bacteria and then flush them out from the small intestine. But when someone's pregnant, you don't want to do any kind of cleansing or any kind of detoxing because all the stuff that you're dumping will go through the placenta to your unborn child. And the size of your unborn child is so much smaller than you. So it's, for us, gosh, it would be like walking into a chemical shitstorm. So you don't want to do that to a baby for sure. So if someone was pregnant and they came to me with SIBO or IBS, I would manage symptoms as well as we could until they were no longer breastfeeding, and then we could start the clearing out. So then that could look like reducing the fermentable carbohydrates, but at the same time supplementing with other prebiotics, because we do need the prebiotics, which is the food for our bacteria. So there's something called partially hydrolyzed guar gum, which only selectively feeds the good guys but doesn't feed the bad guys. And then so diet would be the most important part of that. So finding out what makes her feel best to get her through to the point where we can take care of the SIBO.
Take care of the SIBO. And do you find that things like just the chronic fatigue syndromes, a lot of the time, most, people complain they're constantly tired, tired of just feel like I can't get my energy, so I'm going to drink 10 cups of coffee because that's a great solution. But I hear it all the time, and it's, or they say, I just feel like maybe I just need more sleep. I'm just tired all the time. And a lot of the times, again, I say, well, let's talk about what you're eating. And they're like, what does that have to do with me being tired? So can you talk a little bit about that?
Absolutely. So I've had adrenal fatigue as well. I am my own business. I love to do all the things. I push too hard. This is also when I was going through, I also had parasites. So I had SIBO and parasites. So I was going through all this at the same time. And I just kept putting my fatigue down to being so busy. And then I ignored it. And then I got a big fat lesson and I was knocked down completely. So I was really tired. When you made a comment about we are what we eat, but we are what we absorb. Because if your digestive system is irritated and inflamed, there's these little things inside there called the villi. And on these villi are the microvilli. To get a visual, if you imagine the seaweed and the fish swimming through the seaweed and the fish get cleaned, as our food comes through the intestine, these villi and microvilli release enzymes to break down this food and absorb it into the bloodstream. But if you don't have them, then food just passes through and you don't get to absorb. So you can have the best diet in the whole wide world, but if you've got no way to absorb it, it's not going to do you any good. And then your cells don't get the nutrients that they need to make the energy. And then brain fog is a very common symptom. It's kind of like that one where you feel like you've got cotton wool in your head. So in our digestive system, we've got these things called the tight junctions, which are the barriers of the intestines, and they kind of come together like a set of teeth. So they lock up. But if they've been irritated for a while, and gluten is a big cause of this, it's called leaky gut, so things leak through. There's a similar barrier by the brain, it's called the blood-brain barrier. These tight junctions can become leaky there as well. Not as often used, but like the term leaky brain. If the brain becomes inflamed as a result of all the stuff going on in the digestive system, we can get this brain fog, and it's very hard to concentrate. You can also get depression and anxiety. If we have an overgrowth of the wrong kind of bacteria in our digestive system, they have these things called lipopolysaccharides, which are very inflammatory to the body. And this is actually how they test pharmaceutical antidepressants. They'll inject mice with lipopolysaccharides and then try the pharmaceutical on them to see if it's effective. So that's another way of doing that. With the 10 cups of coffee, it might give you a short-term burst, but you're just going to crash after because it causes your adrenaline to spike, and then what goes up must come down, so then it drops down. So then you need some more, so then you have some more, and then you crash and crash and crash. And that's going to mess around with your blood sugar levels as well. And then chronically up and down blood sugar levels can mess around with your digestive health as well. So it's all connected, and sometimes it's the chicken and the egg, but does it even matter because you need to deal with both?
Yeah, it's just one vicious cycle.
But just like it's a downward spiral, it can totally be an upward spiral when you start getting on the right track. And the digestive system is so amazing because it has the ability to heal really quickly in comparison to some other things. So if you get on the right track with your food, you can feel results within 3 days. It might not take you that long to get better. It might take a little bit more work. But as you go, it just gets better and better and better and better. So you don't need to wait. Yeah.
And now I also work with children. I do pediatric pelvic health as well. And we're finding nowadays, in general, a lot of kids, the diet is just horrendous. Now, here in the States, I mean, for instance, school lunches, they're not necessarily the best. Not necessarily as wholesome. A lot of foods are processed. There was a stat on the radio recently I heard, and they said 90% of parents are giving their children fast food weekly. It's really sad. It's really sad. And so with things like that, I have kids coming in and, parents are asking about bedwetting, or they're saying, well, I need to potty train my child. They're 4, they're still not potty trained. Or and usually a lot of the times the issue is something to do with constipation, and it could be other things, but a lot of these kids are constipated. They're not eating well. They're not eating wholesome foods. They're not eating nutrient dense foods. What recommendations would you make for parents in terms of meals, meal prep ideas, things to give their kids,
Yeah. I'd like to give a heads up that I don't have children of my own yet. So I'm only coming from a place of recommendations. I haven't walked it yet. But I'd probably say slow and steady, finding out with it and hide things in there. So if someone's constipated, it could be, and they're eating fast foods and processed foods, they probably don't have very much what we call microbiodiversity. So there's different kinds of bacteria that help with motility, which is the movement of things through the digestive system. So if someone has very low levels of, say, bifidobacterium, then it's very easy to get constipated. So then you could probably start with like transitioning, because if you go from a fast food diet onto broccoli and kale, it's probably not going to go so well. So you could start with where you're at, and then you could maybe introduce some of that partially hydrolyzed guar gum that I was talking about, because at least they're getting some fiber. Probiotics are definitely beneficial, but just know that they're only transient. So they stay in your body for around 7 days. So you'll get the benefit while you're taking them. And there's certain strains that are better for constipation than others. Probiotics aren't all created equal. Just like a paracetamol will help with a headache and the OCP will help with contraception, you can't interchange them. Well, you can, but that sort of vein. So then if you look at, say, Bifidobacterium infantis, this can help with the motility. So try and find that exact strain to relieve the constipation. And these sorts of things, you can break open capsules and put it into the food, and they'll never know unless they see you do it. And then replacing is always easier than taking away. So if they've got a favorite food, just try and adapt it to make it a little bit healthier, and then the transition will be smoother. And if they don't, and I often say getting kids involved in the meal prep, because they get very excited about cooking. So involve them in your meal prep, involve them in your cooking. If you've got the time, totally get their mums are busy. That can be another way. Smoothies can be good if you make them taste good. You can hide heaps of nutrients in there. and you could add in some banana and some cacao powder, and that will make it taste like a chocolate milkshake. Just hide the other goodies in there. And if you keep good food in your fridge, you will eat well.
Yeah.
So I think preparation makes things so much easier, because if you're tired and frazzled and you had 11,000 things to do all day, and then your child is screaming and hungry, I totally get it. It can be so much easier to go to McDonald's and get a takeaway. But if you've got the food there already in your fridge, and you can cook in bulk and freeze, then there's always something to pull out.
Mm-hmm.
Yeah.
Awesome. And now, what about things we hear about? I tell people a lot about psyllium husks, chia seeds, different things like that. And there's so many different things that you can use. Obviously, everything has its own purpose. But again, most of the time, those are for bulking, not necessarily for anything else. You may be having a little bit of loose stools, or you may be having a little bit of difficulty just kind of passing stools. Do you recommend those often for your patients?
Yes, depending on where they're at in their treatment. So if someone's got really full on SIBO, then there's certain fibers that you don't want to introduce just yet. Psyllium husk is pretty safe, so there's not too much in there. And then with the microbiome, which is all the genes of bacteria in our digestive system, you want diversity. So the ones that you just mentioned there, they have got some wonderful fermentable fibers, which is the food for these bacteria. And then we want to aim for a variety of at least 40 different plant foods per week, which sounds a lot when you hear it, but a serving size of a teaspoon and up counts. So that could mean like a teaspoon of rosemary would help. And then different colors of the same thing can help. So a red apple, a green apple. And then the 40 different plant foods is going to feed all the different kinds of bacteria. So with chia seeds, that wouldn't be so good for someone with SIBO, but if you don't have SIBO, that's absolutely fine. The definitive way to know if you've got SIBO, well, the gold standard that we use at the moment is a breath test. I prefer to use the lactulose breath test, but some practitioners use the glucose, so you can do both as well. In the States, I don't know why they do this. They've made it that lactulose you have to get on prescription. It's only a sugar molecule. So you'll need to go to your doctor to get that. Otherwise, I've got a lab that I use in Canada for my clients in the States, and we just get the kit sent over. It's a lot cheaper as well. It's only 210 Canadian dollars. Mm-hmm. So that's always available. So then you know if you've got SIBO or not. Because if you don't know, you could spend so much time going down the wrong path and wasting time and money, and it can be really frustrating. If you know that you've got SIBO, then you know that you need to be very specific with your foods for just a little while. I don't like to do it for too long because you starve things and it can make you crazy, and I don't want anyone to develop more issues with food, because a lot of us that have had digestive issues for a while tend to develop this fear around food. So I'm very big about not doing that. So yeah, the chia seeds, flax seeds are really good too. And then the chia seeds and the flax seeds also have the added benefit of having the omega-3s, which are very anti-inflammatory. So with pelvic pain, if there's lots of inflammation, this can be very beneficial. There's partially hydrolyzed guar gum. There's other fibers called FOS and GOS and MOS. Those are your fructo-oligosaccharides. Acacia gum is quite nice. There's quite a few different ones.
Awesome. And so with the lactulose test being the gold standard for diagnosing SIBO, how do you typically have your patients with IBS diagnosed? If somebody's listening to this and they're saying, well, I'm having these symptoms, what do I do?
Yes, so the test is, if someone's even got a hint of maybe they've got SIBO, it's so worth testing. Mm-hmm. And I'd say about 95% of my clients that have had tested have come back positive. Mm-hmm. And when I got my diagnosis, it was both disheartening but also very exciting, because I finally knew that there was actually something wrong rather than all being in my head and that I was just broken and weak. So if you want to do this test, I've got supplies all over the world. There's different labs. My favorite technology I like to use is the Quintron technology. So you can ask your doctor about that one, and then if you want me to order you a test, I'm happy to do that. Or the lab in Canada is just called SIBO Canada, and they do ship to the States. Mm-hmm. In the UK is also, you can't get lactulose unless you're with your doctor. So then I've got a lab in Germany that kind of services everyone in Europe. They don't have a website, so it's info@sibolab.de. And then in Australia, I use sibotest.com, and as well, anyone can order off their site. That's no problem. And then getting the lactulose. And then once you get that test kit, you'll need to do, and I don't recommend changing anything until you've done that test, because you don't want to get a false negative. So don't start any microbials yet, don't start any antibacterials yet, and don't change your diet too much. And then just before you do your test, you'll need to do a prep diet, which is 1 to 2 days. So 1 day if you're having regular bowel motions or diarrhea, 2 days if you're feeling constipated. And this prep diet is designed to reduce fermentation in the digestive system so that when you do the test and you drink this lactulose solution, if the bacteria in your small intestine, they'll wake up and release the gases, because it's either the hydrogen gas or the methane gas. And this is what often causes the bloating. So you'll measure those amounts. The prep diet is very boring, but I mean, it's not hard, it's just boring. So it's trickier for vegetarians. I'll come to that afterwards. So it's pretty much chicken, eggs, white fish, a little bit of jasmine rice if you've already been eating grains, but otherwise, if you can leave it out, do. And then a little bit of olive oil, a little bit of coconut oil for cooking. And so if you're a vegetarian, then your only options are really the rice or complete fasting. So just doing like a water fast for a day or two. And the oils. Yeah, and then just for a day. And then you send the results back to the lab, and we tend to get the results back within a week.
Okay.
So it's so easy to do. You can do it in the comfort of your own home. And then it just gives you that peace of mind, knowing or not knowing.
Yeah. And that's hard because a lot of times, like you said, people, they may go to a doctor, the doctors don't test anything. They're like, you're fine, or take this, and they just give them something to mask symptoms. They may go to someone else when that doesn't work, and they keep going around to all these different clinicians and not knowing what's wrong, or they're being told, well, it's just in your head, and the same goes for a lot of pelvic floor issues. If they've not been to someone who can clearly say, this is what's going on with you. A lot of women spend a lot of time going around to different clinicians, and they're like, you're fine, it's in your head, don't worry, we can't find anything, there's nothing on x-ray.
Yeah, I've got so many clients come to me telling they just got IBS, and it's like, but why have you just got IBS? It's not just something. And I'll always ask for copies of test results, because the number of times my clients just get told, oh, everything's fine. I was like, oh, no, I want to have a look. And a really good example is, like, say, with vitamin D. So the reference ranges for vitamin D by the labs are between 25 nanomoles and 150 nanomoles. But if someone is 26 nanomoles, they're told that they're fine. It's like, well, no, they're very, very low. The ideal is actually 125. So rather than letting it get to the point, I've actually even had someone tell me that they went to the doctor with, they're pre-diabetic. And the doctor told them, well, you're not diabetic yet, so come back to us when you are and we can get you on some medication.
Wow.
I was like, wouldn't you just rather fix it before it gets to that stage? A stitch in time saves 9. So, yeah.
And it's I think it's so hard for a lot of people, especially nowadays. We've got so many advances in medicine and technology and just in healthcare in general, but sometimes it almost feels like we've taken a few steps back, with things like this where, people can have help, but it's like they just don't know where to turn, unfortunately.
Yeah, I
So
know.
if anyone, felt like they were having issues with this, if anyone wanted to reach out to you, how would they do that?
So I've got lots of information on my website, which is just www.kirstenswales.com. And I've got all the information on what I do, how I do it. I'm 100% online. And then I've set myself up with, because most of my clients are actually in the States or in Europe or Australia. So I've got suppliers everywhere. So we do protocols online, and then I organize testing, I organize supplements. So that's all done for you as well. I am pretty, what's the word? Big, not big. I'm there a lot on Instagram. I post a lot on Instagram. So I do like little mini blog posts on there most days. It's all about SIBO. It's all about IBS. I've got lots of information there too. And that's just at Kirsten Swales Naturopath. I'm on Facebook, which is Kirsten Swales ND. And then via email, it all goes to my assistant, which is intern@kirstenswales.com. I'll give you all those details, maybe put them in the show notes.
Yes, you will. So that's awesome. Well, thank you so much for your time. Thank you so much. I know that this will be helpful for a lot of people. Like I said, working in women's health, I oftentimes go back to, what is your diet like? Or, what's been going on? Kind of don't give me just the snapshot. I know you're having pain here, but don't give me the snapshot. Let's talk a little bit more and dive into, you as a whole. And oftentimes you find out there's so much more going on than just what they're even coming to you for. And
Yeah.
so it's good to know that there are resources that exist for a lot of women and just anybody in general. who may be dealing with these things. So thank you so much.
You're so welcome. Thanks for having me.